Welcome back. Indeed. It's time for the health segment.
Yes, indeed. Now, on health, we will be talking about diabetic foot care. Now, why it is important and how to do it right. We have with us Dr. Damien Avar, a.k.a. the Sabi Doctor himself. Tell us a bit about him, Titi.
Now, if you are someone who's interested in finding out more or being educated about your health online, his posts will likely have come up once or twice, especially on Instagram. So, yeah, he's a practicing medical doctor with expertise in sexual health. And as an award-winning health educator, Dr. Damien leverages on social media to promote health literacy and positive health behavioral change. Yes. Welcome back to the show.
Thank you, Titi.
Always good to see a brother with a very, very good, healthy afro.
What is it with this Afro Club, babe?
Don't worry. Some other day we'll talk about that.
No time, no time. So diabetic foot. You specifically said diabetic foot in this instance. Yeah. For people at home that don't understand what it means, please break it down.
Okay, so when we say diabetic foot, we talk about diabetic foot care. What we're trying to emphasize is the fact that people who are diabetic, are prone to suffering injuries, fit injuries, which can worsen and become so bad that they may have their feet or foot amputated, as the case may be. So when we talk about diabetic foot, that is what we're trying essentially to avoid, the amputation or eventual amputation of the foot.
Well, why are the feet so susceptible to these injuries that never heal or take time to heal?
Now, the thing here is there is something called neuropathy, diabetic neuropathy. Essentially, it means nerve damage. It is a gradual, progressive nerve damage that tend to happen in people with diabetics, especially in people with diabetes, especially when it is poorly controlled. Yeah. Now, of course, the nerve damage can happen in any part of the body, but what we have seen over time is that the nerve damage tends to affect typically the foot a lot more than all the other parts of the body. So what happens here is that depending on the extent of the nerve damage, one will notice over time that the perception of pain in the feet, is diminished or lost. The implication of that is that if that person has an injury on the foot, the person may not even know that there is an injury. Of course, the pain sensation is not there, so the person does not know that there is an injury. And also, because they tend to also have problems with blood circulation, particularly to the feet, foot injuries can be excruciatingly difficult to manage. Okay. A tiny cut or foot injury can progress very rapidly to become, a serious foot ulcer that may eventually warrant an amputation of that, limb to save the person's life.
Goodness me. Now, we have taken it all the way to the end now, because you're saying that this is something so dangerous that a person could lose a limb.
Yeah, absolutely.
And this issue of diabetes, people have heard about diabetes before, but what is the major cause of diabetes?
Okay, so, depending on what you the type you are looking at, all right? You have the type 1, you have type 2, you also have gestational diabetes. If you're looking at type 1, there are immune problems associated with it. Where, cells in the liver that produce insulin get affected, all right? That can affect insulin production, which consequently leads to diabetes. Then you have type 2 diabetes, which is also known as, which is a result of a partial reduction in insulin sensitivity or, volume. So what you see in type 2 is there is some insulin, okay, which helps with mobilization of glucose or sugar into cells. But the insulin is not enough. Or you could have a case where the cells that are meant to mobilize glucose into them are not so sensitive to insulin. Okay. We call it insulin resistance. So, there are risk factors. You can't specifically say this is what actually causes it, but there are risk factors. For example, family history of diabetes is a strong risk factor. So if a parent or a sibling, a close sibling has diabetes, okay, there is a risk that, a high risk that, another sibling will develop it. Okay. There is also the issue of obesity, is also one of it. Obesity, yes. Then there are other medical problems.
Okay. So going back to the foot problem now,
Yes.
How can people with diabetes make sure that they don't go down this lane where they have an injury that cannot be cured? And does it mean that all injuries in that state cannot be cured?
Okay. No, it doesn't mean
Okay.
that all injuries will not be able to be cured. All right. It's just that they have a high risk of, progressing to, a stage where.
So how can they guard against these kinds of injuries?
Okay, so there are do's and don'ts when it comes to diabetic foot care. The way we say is, in addition to maintaining a very healthy blood glucose level, that's very, very important, crucially important. In addition to maintaining a healthy blood glucose level, number one, you want to encourage them to examine their feet daily. So daily examination of the feet. Okay, and what are you looking for? You're looking for blisters, you're looking for sores, you're looking for redness, swellings, anything that can point to, an injury.
It goes without saying that you can't afford to wear tight shoes or shoes that will cause damage to your feet.
Exactly, I'm getting to that. So one of the problems is they also tend to have issues with their vision, so some degree of visual impairment. So for those kind of people, they may actually need someone else to help them with the feet examination. Wow. So that's number one. Okay. Number two, daily washing of the feet. Extremely important. And how do you do that? You wash with mild soap and lukewarm water. I should emphasize that before you wash, you use your elbow, to test the water, or have someone else test the water for you to make sure that the water is not hot before you use, because you can actually cook your feet without realizing it. Number three, okay, very, very important. Number three, very, very important. You want to moisturize.
Okay.
Okay, you want to moisturize the feet, with petroleum jelly. Okay. However, when you are moisturizing, make sure that you don't moisturize in between the toes, because it can actually trap moisture and make that place wet and conducive for, fungal infections to establish in those places and complicate, Then there is also, the emphasis on shoes. Extremely important. Okay? You want to wear shoes that are spacious and fit very well. So you are going for shoes with soft soles and interiors, example, canvas, suede, and the likes. Okay? In addition, before you wear your shoe, we advise that you turn them over so that if there are, particles, stones, any other object in the shoes, they fall out before you put in your leg. Okay? I mean, there are quite a number of them, if I may go on.
Yes, go ahead.
Okay,
go ahead.
So that's that on shoes. Then we also advise that they wiggle their toes and move around their feet frequently to allow adequate blood flow. Also, we advise that they wear well-padded socks, preferably cotton-based, socks, when they are going to bed or in cold weathers to provide warmth to their feet. We also advise that when they want to buy shoes, they go for it in the evenings.
Oh, wow.
And the reason is because, as you go through the day, when you get to the evening time, there is some degree of swelling of the feet, puffiness of the feet.
I
so
get it.
you want to get a size that can accommodate that swelling.
Okay.
All right? So that you don't buy a shoe that, in the morning it fits perfectly well, but by the time you get to the evening, it's already tight. Then finally, I should really emphasize this, because this is an area where patients often, have problems with. When you notice a cut, you notice an injury, you notice anything wrong with your foot or your feet, as soon as possible, contact your doctor. Don't wait until the next day. It can happen so rapidly. In the space of 12 hours, a foot that you saw earlier in the day could turn black and fall off.
Oh, wow.
So as quickly as possible,
Wow.
contact your doctor. Those are the do's. We also have the don'ts. Number one, do not cut your finger or your toenails by yourself.
Oh.
Oh, wow.
Why is that important? Like I mentioned earlier, they tend to have problems with their vision.
You might just
So
nick
they
yourself.
may not really be able to appreciate the extent to which to cut, and can,
Cut their
you know,
own skin.
inflict injuries on themselves. And they may not even know, because they might probably not even feel the pain or not see the blood.
Can we have one more don't before we go?
Yeah.
Okay,
One more.
one more don't. Which one should I really emphasize now? Okay, don't walk around the room. Don't walk around barefoot, even in your room. So you must make sure, we advise them to get Crocs.
Okay.
So you get Crocs and wear even in your house to
wow.
prevent, you know,
Dr.
injuries.
Damien, it's very
fact-
interesting. I mean, you have just schooled, even I mean,
Honestly,
That's,
over-schooled us today on this issue of diabetic foot, and hopefully someone at home has learned
I'm
something.
very sure. Even
Yeah.
if you don't have diabetes, I think these are points that you actually have to take note for.
Yeah, sure,
Very
sure.
interesting. Thank you very much for joining us.
All
again.
right.
Looking forward to you coming over and doing some justice to some health
Sure.
issues here.